Hi, my name is Dr. Iraj Kasimi from Hillcrest Dental. We've been getting a lot of questions about emergency dentistry, so I wanted to go over those with you. So a dental emergency would be, some type of appointment designed to help a patient out who's usually in pain or possibly missing a tooth for cosmetic reasons, wants to get that repaired. Great question. So, sometimes we get asked, when do I go to an emergency room in a hospital compared to coming to us here at the dental office? I would say you go to the hospital when it's something where it's, you're having trouble swallowing or breathing or anything super urgent like that. If you have a true dental emergency, they don't usually have a dentist on staff, so they probably won't really be able to help you out other than being able to prescribe you some kind of antibiotics or medications. But usually in all other cases, you want to notify us. We have somebody available all the time to be able to respond if you have a question, and we can get you in as soon as we open and get you out of pain. So some of the common types of dental emergencies includes infection, you have swelling, you have pus drainage, your face could be swollen, tooth pain itself, when your tooth is in a lot of pain, a broken tooth, a cracked tooth, a broken front tooth or a crown or missing front tooth that happened due to trauma or any other reason. So these are some typical examples of a dental emergency. One would need an emergency dental extraction if we'd bring you in and evaluate the tooth. If we determine the tooth is not savable, or we decide it's not worth saving, and it's causing you pain or infection. These are typical situations where we would recommend an emergency dental extraction. So someone could need an emergency root canal if they've had a cavity that entered into their nerve, or they broke a tooth and the tooth is in a significant amount of pain, but we still want to save the tooth. If that tooth is savable, there's enough tooth structure remaining to be able to still keep that tooth, which is always a preference. If we can save a tooth, we will. These are typically when we would do a root canal. Yes, we do offer same-day dentistry. We're open typically until 5 or 6 p.m. depending on the day. So we can get you in, a little bit later in the day, or first thing in the morning is another option. Sometimes we'll bring you in, take a look, get you on some medications, and then get you back the following day to do the treatment. So it just depends. But typically, if someone's in pain, we're going to see you that day to help you out. Well, I hope I was able to answer some of your questions that you may be having in regards to emergency dentistry. We're always available to answer any further questions. Please feel free to call us or text us at 702-395-1088, or you can visit us at hcdentallv.com.